My goal as a clinician scientist.
As a scientist,
my goal
is to help people breathe better by clearing the air.
My goals are to make fundamental discoveries we can translate to improve human health and to mentor the next generation of scientists.
As a scientist, my goal is to identify lung cancer earlier through lung cancer screening and biomarker technology.
As a scientist, my goal is to create glycan-specific antibodies to study the brain, cancer, and human health.
Is to study how tolerance is regulated in autoimmune diseases, to devise new and more effective forms of treatment for these conditions.
Improving psychological outcomes of families affected by cancer. I hope to do that by developing and testing culturally congruent nurse-led psychological interventions.
As a scientist, my goal is to bring better treatment options to my patients.
Is to provide high quality, high value, and equitable healthcare to the patients that we serve.
Is to improve the cascade of care with antimicrobial prescribing and utilize data to inform better patient-centered care.
My goal is to understand the ethical and human aspects of critical care medicine.
Is to improve the health of pregnant people and their infants, as well as to inspire the next generation of reproductive scientists.
Is to uncover the immunology of hidradenitis suppurativa and help new therapies that will benefit these patients as well as others with complex skin diseases.
My goal is to understand the role of inflammation in liver diseases by discovering molecular and cellular targets for therapies for patients with liver disease. During this journey, I'm passionately committed to train the next generation of scientists and particularly to pave the way for the success of women in science.
My goal is to expand our understanding of the role that microRNAs have in cancers and other ailments.
Is to create new, innovative educational procedural tools for new learners to help them be better prepared to work with other team members and healthcare providers to provide the best possible care for our patients when it counts the most.
My goal is to increase awareness within the rewarding world of STEM and to attract more minorities to the field.
Is to find new approaches to prevent and treat both type 1 and type 2 diabetes.
To develop better therapies for patients with GI disorders and cancer.
Discover how sleep supports host defense mechanisms, how sleep helps us to recover from infection or injury.
My goal is to continue to advance and promote the field of fertility and to engage in advocacy, optimizing reproductive health for all individuals.
My goal is to contribute to a better understanding of why sleep disturbances lead to increased chronic pain risk, in particular in females. And I hope this kind of research will one day lead to better and sex-specific treatments.
My goal is to understand how dysfunctional brainstem circuits contribute to very challenging symptoms such as walking and balance problems that are so common in the setting of aging and neurodegenerative disorders.
And as a scientist, my role is to find new solutions to all problems.
It is my goal to protect the rights and welfare of human subjects involved in research activities at our institution.
As a scientist, my goal is to provide effective technology solutions for research.
As a scientist, my goal is to increase treatment options for cancer patients.
To improve the care, improve the lives of older adults with rheumatic diseases.
Is to discover how best to deliver advanced oxygen therapy to hypoxemic adults in resource-limited settings in sub-Saharan Africa.
As a scientist, my goal is to prevent and treat diabetic kidney disease.
My goal is to apply our research findings to improve survival and quality of life of our patients.
As a scientist, my primary goal is to understand the mechanisms that govern brain function and dysfunction to develop novel therapeutics for brain-related conditions such as cognitive aging.
Is to define the molecular pathways that drive cancer therapy-induced cardiovascular toxicity so that we can develop new therapies that protect the heart and enable patients to receive their life-saving cancer treatment.
I have been a health outcomes researcher and scientist for over a decade. My science has revolved around improving clinical alarms, optimizing communication in the operating theater, and even digital hotspotting of infections. This is true science at the bedside, and the impact has been very real.
Is to equip and empower nurses towards research, innovation, and evidence-based practice that ultimately reaches the bedside and produces positive healthcare outcomes for patients, families, and staff.
As a scientist, my goal is to improve the health of patients living with heart failure.
My goal as a scientist is to implement my clinical experience into better understanding and treating specific brain neurodegenerative disorders.
My goal is to develop cutting-edge technologies for personalized medicine, improving patient outcome through innovative medical devices and therapies.
Because I find it very gratifying to see my passion for numbers being put into practice of patient-centered outcomes research.
Is to improve the lives and quality of life of patients in our community living with primary and secondary forms of immune deficiency.
As a scientist, my goal is to increase the number of people screened for lung cancer and integrate lung cancer screening into standard of care practices.
My primary goal is to translate my team's over 25 years of research on the A20 gene into transformative gene therapies for patients suffering from chronic and debilitating conditions such as cardiovascular diseases and diabetes, but also to improve outcomes of organ transplantation. However, what I see as my crucial and utmost mission is to transmit my passion for innovation and discovery to the next generation of scientists, physician scientists, and surgeon scientists. Together, I know that we can shape a brighter future for our patients and for an inclusive and equitable healthcare system.